Hello and welcome, and thank you for joining us to our next live presentation in our pop-up series. One is called Picky Eating Unpacked. Just as a reminder, these pop-up presentations come to us when a certain professional development need or opportunity pops up. And so we hope you all found your way here, and we'll get started. A few things, just a little housekeeping to go through. The presentation portion of today's gathering will be recorded and shared on our YouTube channel. So this first half hour, Rachel will be sharing information with us, and you'll be able to find that later on our YouTube channel. The second half an hour will not be recorded, and that's the Q&A session. This is Rachel's second pop-up with us, and so from experience, I can tell you that that second half hour will be rich with discussion. So we hope you can stay with us and spend that time in our Q&A session. We ask that to cut down on background noise, that everyone keeps your mic muted during the presentation. But of course, when we step into that Q&A portion of the presentation, please mic up, right? You can turn on your cameras and turn on your mics, and we'll have a nice discussion. We ask that you please hold any questions for that Q&A session. If you have just a need for clarification or you can't access or hear something, you can put that in the chat. Many of us from the resource team are on today's pop-up presentation, and we'll be able to help you. And then just lastly, we always like to give this little caveat that while we are excited about Rachel's information and we're so happy to welcome her, we don't necessarily agree or disagree with the information that she's sharing. Typically in resource, we vet and do some research into anything that we share on our website. That is not the case with pop-up presentations. So we just always like to give that little disclaimer. And with that, I'll introduce our speaker for today. As I said, this is Rachel's second pop-up with us. She did a pop-up presentation a couple months ago on normal feeding and swallowing development, and it was so well received, and we got such great feedback that we asked her to come on back. So Rachel is a speech therapist in our very own Wisconsin Birth to Three program. She works at Penfield in Milwaukee County. Rachel's worked with feeding and swallowing across the ages. And so she comes to us with a lot of expertise. She also has a feeding and swallowing mentor group that she leads. So with that, I will hand it over to you, Rachel, and we'll just take a brief moment while I pull up your slide deck.
Thank you so much. And I really appreciate it because like the tech stuff with presentations is not my strong suit. So thank you.
Of course.
So we're gonna talk a little bit about picky eating today. And so like we're only going to have 30 minutes for me to talk about it. So of course, like I won't touch on everything that goes into like picky eating. Like we're not going to be talking about like treatment or assessment. We're really just looking at like what are some of the underlying causes for like why children might become more selective. All kids are different, and so they're all very individual. So keep that in mind. I think this is just more of a place of like where to start because if you're going to treat or evaluate for something, or especially treat for something, you want to know what's causing it or why it's happening, and then you can find a more appropriate route as far as treatment. So this is a phrase that I like to think about a lot. It comes up in a lot of, I didn't come up with chasing the why. It's something that comes up in a lot of like trainings and continuing ed and across like different professions. But basically, it's really important when it comes to kids who have feeding issues about, you need to think about chasing the why. So basically, that just means looking beyond surface level behaviors, emotions, or results to understand deeper underlying causes, motivations, or needs. And when that comes to selective eating, that brings up we were looking at child characteristics, parenting practices and styles, negative mealtime experiences, and lack of exposure. These are like the four main categories of things that we look at that might cause a child to become more picky or selective. So when we talk about characteristics, there are a few different things that we look at. So one of those is temperaments. So this is something that is not in our control. Research shows that picky eaters are more likely to have certain temperaments, like they might be fussier, more sensitive, or emotionally labile. Research also shows that picky eaters are more likely to have anxious temperaments. So some examples would be like maybe they have strep throat and they have a vomiting episode with strep and they might become more selective after that. Or possibly like, they went out to eat and got food poisoning. That is something that like a child with a more anxious temperament might be more wary about trying new food or going to eat at a restaurant after an instance like that, whereas a child who might be more confident or calm or regulated might not have that same reaction. So, temperament is something we don't have control over, but it's something to take into consideration when we think about why a child might be a pickier eater. Also falling under child characteristics are different medical issues. This is a really big one, especially in birth to three in our profession. So things like sensory processing differences, GI issues. A big one for little ones is like reflux, EOE, which is short for, and I'm probably going to mess this up, but eoencephalitic esophagitis. Please jump in to correct me if I got that wrong. But yeah, EOE, constipation, diarrhea, GI issues are like the first thing I ask about when a parent brings up feeding concerns to me. Other issues include allergies, allergies to certain foods, sensitivities to different foods, cardiac and respiratory issues can complicate a child's ability to eat and interact with foods, developmental delays, differences in muscle tone, and time spent in the NICU. These are all characteristics a child might have in their medical history that might impact whether or not they become a selective eater. Again, do all kids with allergies or GI issues are they're not all picky, but it's something that you definitely need to consider when you are confronted with a child that's more picky. Another characteristic to consider would be neurodevelopmental differences and disabilities. So, examples would be autism, Down syndrome, ADHD, cerebral palsy, and Noonan syndrome. These are all different, and it's not limited to this list, but these are all diagnoses that tend to have a feeding or sensory or pickiness, like when it comes to feeding, they all have different concerns or issues when it comes to eating food or trying new foods. And just like for an example, when it comes to autism and feeding, I really like this visual. It's from feedingmatters.org, and it talks about all the ways that just the diagnosis of autism can impact a child's eating. So it says that eating is the only bodily task that requires the use of every organ and all of the senses. Many children with autism spectrum disorder have difficulties with sensory processing, and this can make eating certain foods a challenge for them. So researchers found that 69% of children with autism were unwilling to try new foods, and another 46% had rituals surrounding their eating habits. Feeding struggles are often underlying symptoms for over 204 diagnoses. Um, GI systems occur in nearly 50% of children with autism. Over 90% of parents with children who have autism disorder report that their child had problems at meal times and picky eating, including food refusal, limited variety, and specificity in presentation. Like, I don't know if you've ever had a kid who will only drink out of one bottle or they'll only use one plate or one spoon. All of these occurred in about 50% of 18 to 24-month-olds. And they were described as picky by their mother. So, just like one example of how a diagnosis can have such an impact on whether or not a child might be picky. Um, After talking about like temperaments, it's important to talk about the parent. So, Oh, it was from feedingmatters.org. I just saw a question. I know I'm not supposed to look at the question, but one popped up. Um, so parenting practices and styles. With parental anxiety, limiting the types of foods you serve to an infant or child because maybe you're nervous, like, are they able to handle it? I'm not sure, so I'm just going to limit what I serve them. Not allowing the baby or child to feed themselves or explore food independently. Pressuring a child to eat more or to eat less because you're worried. Are they eating enough? Are they eating too much? Catering to flavor or texture preferences at most meals, avoiding messes, allowing your child to dictate the to dictate foods you serve at most meals, and caregiver anxiety around mealtime. So that's like one end of the spectrum. The other end of the spectrum is more permissive parenting, so not expecting mature behavior from their children. So maybe like, not changing your expectations as a child might grow older, serving separate meals and special foods where like maybe the entire family is eating one meal, you're making a special plate for that child because they won't have what you're having. Replacing uneaten food with something new, providing too much food throughout the day without setting limits, offering accommodations and adaptations before the child has a chance to problem solve and try on their own. And I think like so far, all of this, so much of like a feeding evaluation, especially at this age, it's so important to know about like more than just the food and like what's being offered, but about like what's going on at the table, what's going on in the house, how meal times are going, how parents are feeding their kids, because you can get so much information about that. Before you even get to the actual food being served. This is a really interesting study. So this study, and this, I don't know, they'll let me know. You can go to the link, I think, when it's uploaded, because and then there's a QR code too if you wanted to see it. But I think this is all going to be shared. But this study looked at late introduction of lumpy solids. It showed that antecedents of picky eating behavior in young children included late introduction of lumpy solids, so after 9 months of age, and being picky at 15 months old, and the mother being very worried about this. And so, a quote from the study was that the likelihood of a child being very picky at 3 years old was much higher if their mother was worried about their choosiness or refusal of foods in the second year of life. This is just my personal opinion and not like written in there, but I have an assumption that, it doesn't matter if it's the mother or the father, it's probably whoever's feeding their child, but they probably only asked mothers in this study, but I don't think that it's like just an anxious mother. I'm sure there are plenty of anxious fathers, grandparents, cousins, adult children, adult siblings, things like that. I just want to say that's just like my own personal thoughts, not what actually was said in the study. And then this is just a screenshot from the study, but I thought it was so interesting. This was actually something new that I learned when I was working on creating this in service. So basically, like looking at this chart, you see that so they followed children from 15 to 38 months of age, and it shows that being thought to be choosy is very common around 15 months of age, about like 56% of kids, but that this does not always lead to later picky eating behavior. Only 17% of choosy children at 15 months whose mothers were not worried about it were very picky at 38 months, compared to 50% if their mothers were very worried, confirming that maternal worry about choosy behavior in her child is a strong predictor of later picky eating. So, to some extent, some choosiness is typical around 15 months of age, but how a caregiver responds to it might impact whether or not a child is choosy or picky later on in life. Um, Other than what we had talked about already, like the child factors, parenting, healthcare related things, we also have negative mealtime experiences. This is another really big one. So feeding, a baby or child, after they communicate they are full and want to stop, that would be concluded as a negative mealtime experience. I also want to say sometimes I feel like negative mealtime experiences can be peppered throughout what we talked about previously. So, like, let's say you have really bad reflux and you eat and you have a really bad case of reflux after a meal, that would also count as a negative mealtime experience. If you are constipated and when you eat, you feel nauseous, that would be a negative mealtime experience. So all of these are kind of interwoven. You can't really separate them into clear categories a lot of the time. Um, so that was just what I wanted to say about that first one. And then caregiver insisting on holding the utensil when the child communicates that they want to hold it. They're learning really valuable skills. They're learning about, their autonomy and independence, self-help skills, fine motor skills, gross motor skills, along with like their feeding and their communication. So kind of, and I work on this a lot in therapy. It's like, how do we let them do as much as they can by themselves while we also help them and everyone's happy? Wiping a baby's hands and face throughout the meal when the baby is fighting it. This is another big one I see a lot of where it's like, let's try to, teach parents strategies or ways we can clean them, or even waiting to clean them until the end of the meal so they don't associate like, oh, when I sit in the high chair and try to eat, someone's always rubbing my face and it's super uncomfortable. Um, and then again, ongoing stress and pain during meals. So if it's not like reflux or constipation or something medical, maybe their pants are too tight, they're uncomfortable in their high chair. There could be so many things that are creating this like negative experience. Which is why I also like I love birth to three and feeding therapy and that like I can go to your home and see exactly what's happening. I can get the full picture where I wouldn't get that in like a clinic setting.
Mhm.
And then finally, lack of exposure. There is a strong connection between delayed introduction of textured and chewy foods and an increased likelihood of a child being very picky. The one implies there's a reference for that, and I believe it's in the notes. They're probably sharing it. But researchers suggest that there is a critical window of feeding development between 6 to 9 months when a baby is most ready and willing to accept and learn how to chew textured foods. And I think we talked about this a little bit last time, but just because a child might not be like, let's say they're tube fed and they can't be, eating textured foods by 6 to 9 months, there are still ways we can help children participate in meal times to really, use this window of time to help them with that development, without having to wait, but also keeping them safe. So sometimes the exposure looks like, just playing with the food, watching our family members eat, but then like thinking about like if you do have a kiddo who's like typically developing, this is the prime time you want them to be introduced to as many different foods as possible so that they're really learning how to accept different types of food, different flavors, different textures, things like that. So I know that felt a little bit fast. Hopefully that was informative. I know there's so much more we can talk about with picky eating, but I just it was one of those things where I was like, okay, where would I start? And I feel like thinking about the history leading up to why children might become picky and why this might be stressful for parents is a really good first step.
Thank you, Rachel. With that, we will stop recording.